Good morning. I'm Tari King. I'm the chief of the Division of Breast Surgery and the founder of the BPREP program. BPREP stands for Breast Cancer Personalized Risk Assessment Education and Prevention. And we have a great session for you this morning and a great team that I want to introduce you to. So first of all, just a few housekeeping items. The panelists will keep their speakers off until it's their turn. We will have Q&A after each speaker, and we'll be monitoring the chat throughout the session. And as always, this session will be recorded and we will then have the recordings on our website after for durable materials that you all can refer to. If you do have questions, please put your questions into the chat, and we will again try to get to as many of them as we can after the speakers. So this is the lineup that we have for you this morning. We'll have Dr. Deborah Kolek talk to us about hormonal and non-hormonal treatments for menopausal symptoms. Some guests from Silent Spring talking about the environmental chemicals and their link to breast cancer. Stuart Schnitt, our breast pathologist, will give us an update on high-risk breast lesions. We'll have the exercise demonstration from Nancy Campbell. Those of you who've joined us before will remember her, and it's a great opportunity to get up and move around. Then we'll take a small break and we'll come back with an update on genetics, an update on medications for breast cancer risk reduction, and we'll wrap up with the healthy cooking demonstration. So I do want to remind you again that we do try to mix up the topics, and this year we won't be talking about exercise so much or imaging, but again, the videos from last year are on the website. And so if there are other topics that you're interested in, please do remember to check out the website to see the other items that we've discussed in years past. So the BPREP program lives in the Brigham and Women's Hospital Comprehensive Breast Center. We evaluate patients with non-malignant complaints in the breast center. And we really try to do a lot of work around education for patients with suspected or known increased risk, including patients with high-risk lesions, which you'll hear about this morning, patients who want to learn about their breast cancer risk based on perhaps their family history, patients who are seeking additional information about dense breasts, recommendations for surveillance. And we have a great research team and a lot of focus on participating in clinical trials for risk reduction and prevention, and also just what can you do as an individual to take advantage of your opportunities and the modifiable risk factors. So this is sort of how our program looks. Again, the program lives in the breast center at the Brigham and Women's Hospital, and anybody can come to our clinic. And regardless of the reason that you come to our clinic, everybody gets a standardized risk assessment. And when we figure out if women are at elevated risk for breast cancer, if they are, they stay in the BPREP program. And if they're not, then once we've resolved their initial complaint, then they can return to their primary care physicians or their OBGYNs for their routine follow-up. Our team is multidisciplinary, so we have breast surgeons, medical oncologists, a primary care physician, physician's assistants are really the backbone of our team, a patient navigator, and of course, we're all supported by our administrative team, medical assistants and nurse. We have, again, a research staff, and then we work very closely with our collaborators in weight management, genetics, the menopausal clinic, and breast imaging, again, to help make sure that we can evaluate all of our patients' needs and provide them with the best resources and options. So this is our team. Again, across the top, you see the physicians, but really the backbone of the team right here is in the middle. This is our fabulous team of PAs that are in the BPREP program in the clinic every day and really taking care of all of our patients. Kamala Perez is our nurse on the far right. And then on the bottom, this is our research team and our administrative team that really the glue that keeps everything together. And so we hope that you will have, if you have or have not yet had an opportunity to meet some of our team members. So let's just start first with just a little very quick introduction to what is cancer. Cancer is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. And so when we're talking about breast cancer, the breast tissue is made up of milk glands and milk ducts, all going to the nipple for breastfeeding, and then the fatty tissue in between. And so a normal milk duct is just lined by a single row of cells all very uniform, same size, same shape. And when a breast cancer begins, one of these cells goes bad for whatever reason, divides into two bad cells and so on. And this milk duct here now is starting to be filled with these abnormal cells. And this would be called duct carcinoma in situ, or intraductal carcinoma, stage 0 breast cancer. And then when the cells break through the wall of the milk duct and get out to the fatty tissue, that's when we call it invasive breast cancer. So what does it mean to be at increased risk? Well, it means that your chance of developing breast cancer is higher than the average woman. In the United States right now, the average woman's risk of getting breast cancer is about 12%. Or the other statistic that you'll hear is that 1 in 8 women will develop breast cancer in their lifetime. We certainly know that there are risk factors for breast cancer. There are things that put some women at higher risk for developing breast cancer than others. You are familiar with these things. When you go to your physicians, we ask you what age you were when you started your menses, what age you were when you had menopause, childbearing questions. This is because certainly the exposure to hormones during the course of our lifetime has something to do with breast cancer risk. Hormone replacement therapy after menopause, having dense breasts, increased alcohol consumption, postmenopausal obesity, inherited mutations in the BRCA genes and others, exposure to high dose radiation in childhood or adolescence, and again, the high-risk breast lesions. So there's a variety of things that alter one's risk for getting breast cancer, and a lot of work has gone on over the last several decades to try to understand more about how these things are related to each other, and what are the things that we can control. And so again, in the program, we spend a lot of time trying to educate women about their risks, explain how these different factors stack up, if you will, against each other. So you'll see here women who have a family history or maybe drink more than one alcoholic beverage a day, their risk is a little bit higher than the average risk woman. So instead of 12 pink ladies here, we're up to 14 or 15 pink ladies. Women who have atypical lobular or ductal hyperplasia, again, those high-risk lesions, they're up here in the right-hand corner. So now we're getting up to 19 or 20 pink ladies out of 100, lobular carcinoma in situ down here, and then, of course, the inherited mutations on the bottom left. So again, all individual risk factors, they carry different levels of risk, and we want to try to help women understand what their risk is. So again, we do this through a standardized risk assessment when women come into the clinic. And that standardized risk assessment, again, allows us to capture information in all these different categories. And then that information is summarized into a report for us. And this helps us to identify women who may benefit from genetic testing, genetic counseling, or genetic testing, again, based on the information provided, women who may benefit from lifestyle counseling, women who may benefit from enhanced screening or discussions about appropriate risk-reducing medications, again, based on the information that's provided. We focus a lot on the modifiable risk factors. What are things that we can do something about? Again, we know that increased alcohol consumption is associated with breast cancer risk. We know that gaining weight as we go into menopause and postmenopausal obesity is associated with breast cancer risk. And the good news is that there's more and more evidence that exercise is associated with a reduction in breast cancer risk. And so we do talk a lot about exercise. The target goal is at least 150 minutes per week. There is a dose intensity, so the more you do, the better. But once you get up to about 6 hours per week, that's probably the maximum. So you don't feel like you have to run a marathon to get some benefit from exercise. But getting up and moving around at least 150 minutes a week has been shown to reduce breast cancer risk. Again, there's information on our website about exercise. A great talk a couple years ago in 2020. And so this information is there. And then also a talk last year in 2023 from Dr. Ligabel. And so please, I encourage you to check those out if you want to learn more. And again, we will have an exercise demo from Nancy Campbell later this morning. So as we're going to get started. So before the exercise demo, we're going to again have 3 wonderful talks that I'm looking forward to. And I think they'll be very informative for us. Again, talking about hormonal and non-hormonal treatments for menopause symptoms, talking about the link between environmental factors and breast cancer risk, and an update on high-risk breast lesions. And then after the break, again, we'll come back with cancer genetics, update on medicines for breast cancer risk reduction, and we'll wrap up with the healthy cooking demonstration.